the slides are not running, I would just request you.
Is Ultrathin DSAEK, and endothelial keratoplasty has come a long way. With starting with DLEC, we shifted to DSAEK and then automated procedures. And for the quest of 2020 post endothelial transplant, we are decreasing the size of our lenticule, the thickness of our lenticule, going to sub 100 microns, the PDAC, which has the dual-laser and DME and DMEX scroll. So my ideal procedure for endothelial keratoplasty, which gives me a faster visual recovery, better final visual outcome, predictable, which has a low graft loss during preparation, and it's a repeatable procedure, and we are able to perform it in all the challenging scenarios. So this is a randomized multicentric clinical trial, which shows that the results of Ultrathin DSAEKs are much faster and better recovery of best spectacle visual acuity, with similar refractive outcomes, endothelial cell loss, and incidence of complications. So Ultrathin's DSAEK is no inferior to the regular DSAEK that we do. It's a sub 100 microns thickness, prepared by a double pass with the keratome. First, we debulk the 350 microns with a 350 micron head, and then the remaining, depending on the residual stroma, we debulk the rest of the 100 microns to be it around less than 100 microns. So it is fairly predictable. If you have a microkeratome, it has a low learning curve since it's very similar to DSAEK. It's technically less challenging since we all are trained and used to doing DSAEKs, and it has a less incidence of primary failure due to surgeon's factor. So it's a much repeatable procedure. So I'll just show this quickly. One case, I'll skip the steps where I do a cataract in this very hazy cornea. A DMEC or PDAC would never be possible in these kind of cases. I do a SICS for cataract extraction in these cases, and followed by a DSAEK by a push-in technique, which gives me a fair orientation of the graft in the interior chamber. So, yeah. So, in poor visualization and disfigured anatomy, Ultrathin DSAEK can be done, which is not very simple and has a long learning curve in case of DMEC and PDACs. So my closing statement is Ultrathin DSAEK is my go-to procedure for endothelial keratoplasty. Thank you.
Thank you.